I am Dr. Fanoos. Okay, I am Dr. Fanoos Momand. I am reproductive health focal point for Swedish Committee for Afghanistan, and it's been more than 2 to 3 years I am working here in Kabul main office, and I have prepared a short presentation about what we are doing on maternal health in Afghanistan and which projects we are implementing. So I would like to have your attention to this short presentation. Okay. Screen از کجا شیر میشین جاشاین؟
Yes, we see your screen. Now you're mute. Yeah.
Okay. Okay, thank you. Our discussion is about maternal health. Afghanistan report from Swedish Committee for Afghanistan, who is mainly working, you are familiar with that, who is mainly working in 4 programs in Afghanistan, which are health, education, disability, and rural development program. So in health program, we have quite or more focuses on maternal and child health, which is a very burning issue in Afghanistan and most of the countries like Afghanistan, who are developing countries. So first of all, I would like to go upon context analysis of maternal health. The next to exponential expansion of health in the country during the last decade was acknowledged, a very big acknowledge of health and maternal health. It was a success in past decade that the health and maternal health was services were increased and the progress in health had been possible, and we are thankful to the community, international community, as well as great efforts of our own Ministry of Public Health, not least the Afghan people who embrace health for the mothers and families. Although the progress made so far is acknowledged, there is still a long way before achieving the SDG quality health for all. There is still a big number of people who don't have access to health services or matters of concern. Moreover, efficiency, effectiveness, and sustainability are other aspects that require improvement and urgent attention. General challenges and reforms and required reforms in the health system can be put in following categories: high demands, low resources, short-term projects, quality and usefulness of health services for individuals and society, and financial sustainability of the system. So the political transition in 2021 radically changed the health landscape in Afghanistan. In the short term, for many, access to healthcare has improved with the cessation of violence, and the volume of patients suffering from conflict-related physical trauma has reduced significantly. Similarly, there have been fewer incidents of staff intimidation and collateral damage to health facilities. Health services that were already outstretched are struggling with the demand for treatment. Why? Because the situation is particularly difficult for women who face restrictions on travel and shortage of female health workers. Is one of the biggest challenges facing the health sector is the lack of funding. The international community has suspended on-budget aid contributions, leaving a deficit in the DFA's public health budget. So it was a system analysis of health services from before 2021 August, and after that the demands are high because now all health services are easily achievable. Everyone can go to the health facility, can receive the services without any violence or restrictions from fight or any all the Afghanistan is under one government. Comparing to the before 2021, which was there was more than 3 governments in Afghanistan. It was a conflict between them that most of the people, they were not able to receive the health services. Now we will talk about SCA health services. SCA focuses on following 5 areas: access to health, nutrition, and rehabilitation services, quality of health, nutrition, and rehabilitation services, which are 5 areas that SCA is targeting. There are 5 outcomes under this services. First outcome is access to health, nutrition, and integrated rehabilitation services improved in the target groups. Second outcome is quality of health, nutrition, and integrated rehabilitation services improved. Third outcome will be health, nutrition, and rehabilitation behavior of SCA target groups improved. And fourth outcome, improved capacity of community-based organizations, professional associations, and CSOs to promote participation of target groups. Outcome number 5 is improved health system at national and sub-national level. SCA is focusing to receive all these outcomes under several projects which is SCA working on. We are working in many projects of health for different provinces of Afghanistan, which I am going to talk about in my coming slides. Now I would like to take your attention to a new study conducted by University of Hopkins about maternal health crisis in Afghanistan. The surveys were conducted and interviewed completed between February and April 2022, which is obviously after takeover of Taliban. A total of 131 health workers participated in the surveys, including 89 in the first and 42 in the second. 80% of the respondents were female. 2/3 of those participants in the first survey through the local group practice in public health facilities. About 60% practice in rural or semi-rural areas. Half of those surveyed in the NGO survey work in urban centers, and half work at public facilities, and half in private ones. As a result of the global investment in Afghanistan leadership, despite an ongoing war that included violence inflicted on health personnel and facilities, Afghanistan reduced maternal mortality from approximately 1,450 deaths per 100,000 live births in 2000 to 638 deaths, which is a quite big decrease. That infants and as well as in infant mortality rate was reduced from 88 deaths per 100 live births in 2001 to 45 deaths per 100 live births in 2020. 5.6 mortality for children under the age of 5 years was reduced from 125 deaths per 1,000 in 2001 to 58 deaths per 1,000 in 2020. 5.6 access to healthcare improved dramatically with more than 3,135 functioning healthcare facilities. These included primary health centers, district hospital, provincial hospital, and specialized hospitals. Donor support continued under the Sehatmandi program launched in 2018 prior to regime change in August 2021. The vast majority, 87% of Afghanistan population could reach a healthcare facility within 2 hours, which is quite a big, very big achievement. It was a big achievement. Our people, Afghan people, were able to get healthcare services from nearby health facilities. And all the mortality rates, which was maternal mortality rate or child mortality rate or infant mortality rate, were reduced. The findings of this study was a deterioration of conditions for providing adequate care. Almost half of the respondents reported that the condition for providing care were worse or much worse since August 2021. As we all are in the picture, that the most important thing in providing facilities and services is quality of care. Over 40% reported that changes in working conditions or closure of the health facility had resulted in them not being able to practice as a health worker. As we know that in this survey, the respondents were female as well, which these female were not allowed to work properly as they were able to work before August 2021. They described 4 central reasons for the severe decline: lack of regular salary payments, lack of medical supplies and medications, and restrictions and harassment by Taliban, and stresses from the need to work under these conditions with fewer staff. Second is severe decline in availability and quality of care. Not surprisingly, the stress of providing care without adequate staff, pay, supplies, and medication, while also subjected to Taliban harassment, led to declines in availability and quality of care at facilities. We are all in the picture that a gap came after August 2021, where the World Bank stopped their payments to health services of Afghanistan. So, and SCA was one of the organizations that continued their services through this period of time, although all the health facilities were blocked and they were closed because of there was no funder for them, but still SCA continued their work. Half of the respondents practicing in semi-rural settings, 43 of respondents practicing in rural settings, and that 1/3 of respondents practicing in urban settings reported a decline in availability of services. Now the services are available, but almost 1/4 of respondents reported that because of the worsening conditions in health facilities, they were not able to provide care for mothers and children. The third finding was perceived increase in maternal and infant child mortality. There are current efforts to restore sound morbidity and mortality surveillance in Afghanistan, but in the meanwhile, the perceptions of practicing health workers paint a disturbing picture. More than 1/3 of respondents reported that infant and child mortality has increased in a title of increase a lot. Concerns for the future of the Afghan healthcare system, although stopgap measures have kept the Sehatmandi program in most government hospitals functioning. The health professionals we interviewed described the ongoing challenges of access, training, compensation, and freedom of movement. Specifically, SCA is implementing project Family Health House Project and Health Emergency Response projects, which are for maternal health, specifically for maternal health. I would like to paint your attention first to Family Health Houses project. The Family Health House approaches an innovative intervention to expand the coverage of of health services, especially reproductive health services, including family planning, antenatal care, skilled birth attendance, postnatal care, essential newborn care, and IMNCI, which stands for Integrated Management of Newborn and Child Illness. Services to wide areas in an effort towards a sustainable solution to ensure access to universal health coverage. The specific objectives of this project is increase physical, social, and economic access of communities in remote areas to reproductive, maternal, neonatal, child, and health services, improve the quality of health services through training and capacity building for midwives, community health workers, and community health shuras and family health action groups. Establishment of a functional referral system, integration of GBV component into the FHH program, and strengthening community mobilization and ownership of the project through community structure. What is the expected result for FHH project? By the end of 2023, utilization of high quality reproductive health information in maternal health services is increased and selected in underserved areas of Nuristan and Samangan provinces, as well as the strengthened capacity of health facilities and workers to provide reproductive, maternal, neonatal care and health services. SCA is currently running FHH project in Samangan and Nuristan provinces, funded by UNFPA in close collaboration with provincial health departments and local communities. What is the modality of the FHH? Family Health House is a place where we select a midwife from the area. We find a specific land from the same area, and it has a few lines we have to understand before selecting the FHH. We select that there are the population is about 1,500 to 2,000 families, and as well as they have more than 2 hours walk to the health facility, nearest health facility. We deploy that midwife in our community midwifery education school. We train her for 2 years, and to the time we build and construct one FHH there. Through that, the midwife will be deployed after graduation, and she will provide reproductive maternal health services to the people of that community, like antenatal care, postnatal care, safe delivery, and as well as some vaccinations. Currently in Samangan, we are running 31 FHHs, which are established and functionalized, that covers most of the population of Samangan province. And 21 students were graduated on October 2022. In Nuristan, I don't know, maybe you are not familiar with the name of Nuristan. Nuristan is an eastern province of Afghanistan, which is not reachable through one way. When you want to reach to Nuristan, you have to track via 3 ways, via 3 provinces to track one of the districts of Nuristan. Before SCA, it was very tough for the Nuristan people to receive a single service out there focusing on health. Now SCA is having 25 FHH established and functionalized, and SCA graduated 16 students of the training community midwifery education. We trained them in Kabul and deployed them in their FHHs. The second most important project of SCA for maternal health is HER project, which is Health Emergency Response. Before 2023, it was Sehat Mandi, which was started in 2018. Since February 2023, SCA is implementing the Health Emergency Response projects in Wardak and Nuristan provinces. The overall objectives of the Afghanistan Health Emergency Response Project is to increase the utilization and quality of essential health services, including the basic package of health services, essential package of health services, and community facility-based nutrition services in COVID-19 prevention and response intervention in the mentioned province. The HER project is consisting of 2 main components. First, it's covering urgent provision of essential primary and secondary health services. And component 2 is strengthening service delivery and project coordination. These components aim to maintain and strengthen the system needed to deliver high quality services and maximizing the efficient deployment of resources and ensure accountability. Under health contract funded by World Bank channels through UNICEF. SCA is implementing the basic package health of services and essential package of hospital services in Wardak province, and only the basic package of health services project in Nusan province, where we do not have a provincial hospital, to provide essential package of hospital services. The project ensured access to health services to all 670,000 population in Wardak province throughout 77 different types of health facilities and 396 health posts. In Wardak province, SCA is running one provincial hospital, two district hospitals, one comprehensive health center with additional services, which is CHC plus comprehensive health centers, 26 basic health centers, 36 primary health centers, and one BC level health facility for detained people and prisoners, and 168 health posts where one male and one female community health workers are voluntarily working, as well as to ensure access to total this population in the province throughout 37 health facilities and 168 health posts in Nuristan province. In Nuristan province, SC is running total 37 health facilities, comprises of 3 district hospitals, 1 CHC, 3 CHCs, 1 CC plus, 8 BHCs, 22 PHCs, and 168 health posts. Moreover, to contribute to these projects of FHH and her projects, we have some more vertical projects which improves maternal health. These are SIDA funded projects, which is we are implementing for more than 10 years in different provinces of Afghanistan. One of them is Learning for Healthy Life project, which we call it LHL. It's an approach used as health-focused learning method to empower women and raise their awareness about health, especially maternal health. SCA has 270 classes of LHL in different provinces of Afghanistan, like Samangan, Wardak, Laghman, Mazar, and Parwan. The modality of the project is that we select a midwife or a trained lady who has the ability to lead a class and who is a medical practitioner, or maybe a 12th graduate midwife, 12th graduate of school. So the modality is different due to the every area. For example, in one area we can find midwives, so we select midwife, or in one area we cannot find midwife, we can even find a 12th grade graduated lady, so we select her, aiming that she can run a class of 9 months for 25 ladies who are CBA ladies, childbearing age ladies. We train them for 9 months. We provide them all the awareness about maternal health, how they should care about themselves, how they should have family planning, and how they should use methods of family planning in their daily life. As well as we raise their awareness about their children health. We have a referral system in those LHL classes where the teacher refers the students and CBA students, childbearing age students, for their ANC antenatal care visits, for their PNC postnatal care visits to the health facility. Through this, we achieve many goals. One of them is awareness raising policy. The second one is that we achieve the targets we have already set for our health facilities. And as well as the people, they can understand. There was areas we had a pre-assessment and post-assessment of these classes. There were health facilities, but the ladies and those women who are illiterate, they didn't know which facilities, which services are being provided in these health facilities. They were not having skilled deliveries. They were not using family planning methods. So using this class, we raise their awareness, which has helped a lot in our maternal health and family planning and safe deliveries and skilled deliveries. The next vertical project is community midwifery education, and as well as we had community nursing education. It's quite reasonable that I can say that more than 8% of midwives of Afghanistan has been graduated through SCA from different provinces. We can name like Samangan, Wardak, Nuristan, Saripul, Paktia, Laghman, and many more provinces. Now, SC has recently graduated students of Nuristan from community midwifery education. Midwives are the backbones in maternal health, more than a doctor. We had some areas where we were not able to find a midwife that we can hire her in a health facility. But now using this project, we have many midwives graduated in very hard to reach areas who can help the ladies in their maternal health, who can provide health sessions, family planning sessions, and ANC, PNC sessions to the mothers and raise their awareness. And as well as now we have one class running in Parwan province, which is community midwifery diploma. Moreover, I would like to talk about one of our new projects, which is bridging program. Bridging program mainly, as we all know, that there was a survey that now has stated that Afghanistan has sufficient number of community midwives, but they are not skilled midwives, because in that time there was a time that we were not able to find a girl who is graduated from 6th class in a very large populated community. So we were compelled to select that girl who had at least 7th class degree of the school, who was at least able to read and write. So that was the reason that now they are not selected as skilled midwives in health facilities. So SCA has worked on modality of bridging program, where we will select through a entrance exam in Kabul Medical University of Afghanistan, which is the largest medical university in Afghanistan. We will institutionalize bridging program of midwifery in Kabul Medical University. Through an entrance exam, we will select the CME graduated ladies that they can take their bachelor's from a well-identified university, which can help in maternal health of those ladies who are not able to get their bachelor's and get their master's. We very well know this, that in Afghanistan we do not have more than CME classes. Higher than that in many of the places. This is just only the capital of Afghanistan, where one university is providing bachelor's in midwifery. Midwives has been proved the backbone of the maternal health, through these CME midwives, as per my previous slides, that how much we could contribute to take down the maternal mortality rates. So these are all the findings and all about maternal health and what is SCA doing to increase maternal health and to decrease maternal mortality health. And I hope you have taken as much as possible from my slides. Thank you for listening, and now the floor is yours. If you have any question or suggestion, you can let me know.
Thank you very much. Very interesting to hear about the maternal health. Let's see if we have Börje raise your hand. The floor is yours.
Yeah, thank you. First of all, thank you very much for your presentation. It was very enlightening. And I have two questions regarding the Taliban's in connection to female health care. You mentioned Taliban harassment of health staff. Could you elaborate a little bit on that? And second, how is the how are the Taliban dealing with health education for women? Are they okay with it, or do they just keep a blind eye to it?
Thank you. Shall I go with the answers, Laura?
Yes, please. Oh, sorry.
Okay.
Yes,
Thank
yes,
you.
go ahead.
Yeah, I talked about harassment. These harassment, it's not probably gender harassment. You may have heard in news that they have banned women from working. Just they have allowed those women who are working in health facilities, they can go and provide services. But the main point of the Taliban is to have escort with yourself, mahram, someone, your brother, your husband, or someone who is escort to you, who is your mahram under Islamic regulations. So this has created lots of problems because we have many CHWs, community health workers, we have many midwives, who are the only people who do not have a male mahram, to be honest. So they are compelled to leave their jobs because of not having mahram, because they are not allowed to go alone, they are not allowed to go to their jobs in their job duty stations alone. And lots of other regulations has been set on Afghans. Those now, most of the Afghan ladies are not working, except those who are in health facilities, who are working under health. But there are regulations that you have to wear hijab, you do not have to talk to the male colleagues. The portions has been separated. You know that when two doctors or nurses or a team is working in a health facility, they have to have a very good coordination between themselves. When the coordination is cut, so they cannot provide facilities properly because there is not a good coordination. So these are all called like a harassment for female workers of the health facilities. They are not allowed to work as they want, to the regulations they want. More regulation are offered to them. And they are not able to, there are red lines for them that if you are not wearing such kind of hijab, you will not come to health facility anymore. Or you are not, CHW is a lady who is working in community and providing referral system, health seasons, as one of your questions were health education. We had many health education seasons every day in our health facilities, but now they are decreased because in those health educations, we were advising the ladies to talk to your husbands, to involve them in your maternal health, to have family planning sessions. Family planning is completely not acceptable by Taliban, or we can say de facto government. That's not acceptable for them. And as well as in some mosques, they have even told that family planning methods are banned in Afghanistan, and no company should bring them in Afghanistan. So most of our health education sessions and health facilities was about family planning, that our people, they didn't know what is family planning, how to secure family planning, and what are the methods of family planning. So when now we are not allowed to talk about family planning, we are not allowed to raise their awareness about their own rights. What is woman right? We cannot raise their awareness. What they can do, what they can provide, what is their main right in all these circumstances. So we are not allowed to raise their awareness about all things going on around. So this is that it has decreased the health education seasons of our health facilities, and as well as it has harassed mentally the community health workers and midwives and all workers, female workers of the health facilities. I hope I'm clear.
You were very clear. Thank you very much. You answered more than I expected. So
Thank you.
I'm pleased.
Thank you. Okay, any other questions?
I have one, but if there is somebody else, it should go before me.
No, go ahead.
You mentioned that infant child mortality has increased. I can imagine why, but could you please elaborate on that as well? Why more children are dying before the age of 5 or as infants?
Focusing on those areas where SCA is working, SCA is very focusing on quality of care, quality of medicine, quality of providing health services, but still there are other provinces. There are such kind of places where now we had remote ambulances, we had night-based ambulances, we had many of other things where in those times the ladies were able to visit health facility alone, but now they're not allowed to visit health facilities. And as well as the nutrition, poverty is very high in Afghanistan nowadays. And when a lady or a mother is not fed properly, so her baby cannot adjust, and she will that's why the reason is that's the reason of one of the reasons of the high mortality rate. And as well as we have nutrition problems which are very much increased in Afghanistan because of the high range of poverty. So one of the reason of maternal mortality rate is the high increase of poverty, and the second one is that now the services are not being provided to the mothers, to the pregnant mothers properly. That is the reason that both maternal mortality rate is increased and child mortality rate is increased. During 2010 and 2020, we had a very good decrease in these two mortality rates. But now, due to these two reasons, it's again increased. And as well as before 2023, the projects were funded short term, the medicine supplies were not good, and as well as the salaries were not being provided to the midwives properly. So most of not under SCA, because SCA was using their internal fund to cover all these gaps, but other provinces who were implementing these projects, they were completely stock out of all medicines, which caused these high maternal rates. I'm clear?
Very clear. Thank you very much. Thank you.
Thank you.
Welcome.
Have we more questions? I don't think so. So thank you very much for your presentation and your participation. We really much appreciate it, and it was good knowledge, and we learned a lot. So thank you, Fanoos, very much, and we stay in touch. And thank you, everyone who came to listen today. Have a good day. Thank you. Bye.
Bye. Thank you.